our aspiring consultants. Hope you all are well and welcome to the brand new season of Strategy Unplugged. This week, I, Puneet, would be discussing with Shambhavi in detail about the measures taken up by the healthcare sector during the pandemic. I would like to thank Shambhavi for taking out time to discuss the disruptions and how we can move forward in these uncertain times. Hi Shambhavi.
Hi Puneet, how are you?
I'm fine, but these times are really tough to deal with. It feels like nothing can be done to improve the COVID situation.
I know it feels like the situation is bleak, but strategies are being taken to improve the situation.
Could you please elaborate on what is being done to improve our situation?
So the government of India has launched the Arogya Setu app to remove the noise in the data. The national guidelines issued by the government introduce the practices of contact tracing, social distancing, and the categorization of zones based on the number of reported cases. High tech infrared thermal sensors was used to screen the passengers at the airports, and it is also being ensured that the PPE kits are being provided to the primary healthcare providers.
I recently read an article of an interview with Dr. Anu Grover, DGM Medical Affairs, Meenu Grover Sharma, the principal consultant at Business Associate Consulting New Delhi, and they suggested measures about how the authorities can increase the expenditure on healthcare services and introduce traditional practices such as Ayurveda. These measures are useful for enhancing the existing medical infrastructure, but since we are in the new normal, we need new innovative schemes. So, how can we bring new innovative ideas for tackling the pandemic?
Yes, I definitely agree that we need to think out of the box to face the post COVID world. For instance, I had read about the Six Sigma principles and could see that we could improve our supply chain by providing a digital interface for the end state suppliers to connect and overall improve the accessibility of the resources to the consumers. Take the case of Taiwan. They were able to combat corona in the early stage as they were able to create a highly centralized supply chain with the support of digital records, and they were also able to screen out high risk travelers with the help of their database. So, through examples, we can see that efficiency is the need of the hour and we need to focus on agility.
Coming to the supply chain, it seems too humongous to deal with. So, what specific steps can we take to improve the logistics of the healthcare system?
Since the supply chain is too big of an area, we need to take on a systematic approach and by taking a step by step process. First, we need to record the patient experiences at the facilities and see what are we lagging at the end at providing the services to the patients. Then we need to collect their data in the form of genetic history, medical history, blood samples, etc., to understand the pathology of the virus. And then we need to create a common platform for the end step suppliers. Then there is a need for involving the stakeholders, for example, ASHA healthcare workers, doctors, pharmacists, etc., in the decision making process of the healthcare industry, as they are the experts on the field.
Definitely. As far as I can see, technology has a massive role in the current times. So, what other advanced digital tools can we include in a strategy to contain COVID?
There is a scope for increasing the role of technology in our game plan. We can see that through the techniques of artificial intelligence and machine learning, there is a possibility that the accuracy of drug trials can be improved and we can find a potential cure for corona.
So, can we say that we will be able to combat the disease?
We certainly can and we definitely will combat the disease if we keep up with a proactive approach.
Thank you so much, Shambhavi, for taking out time from your busy schedule to discuss an important topic. And we hope that through this session, our fellow listeners are able to take some important lessons and are able to change their challenges into opportunities. With that being said, we end the podcast here.
Thank you guys for being such diligent listeners. Hope to see you in the next episode. Till then, stay safe and stay healthy.